Now at the knee joint, if you see the knee tracking in towards the center of the body, then that's positive for the knee valgus, or the knee coming in. So this can be due to a weak gluteus medius. You can see the gluteus medius here, which is your main lateral stabilizing muscle. You can see on this side that the gluteus medius has just been cut away to expose the gluteus minimus that's underneath. It's also a lateral pelvic stabilizer and hip abductor. So when there's a weakness in these hip abductors and the knee no longer stays in line, the VMO is no longer in the correct line of pull for these fibers to operate correctly, so that tends to get weak as well. Possible weakness as well in medial hamstring and medial gastrocnemius. In terms of the muscles that are going to be or possibly tight, we're looking at, again, the adductor complex. So all these adductor muscles here, which are going to then inhibit the gluteus medius on the lateral aspect of the hip there. We're looking at possible tight vas lateralis, which is one of your quadricep muscles that sits on the lateral aspect of your quads, attaches laterally into the patella here, and lateral gastrocnemius as well, so the lateral calf muscle. Possible tightness as well in the TFL or biceps femoris in your hamstrings. So the suggested test to do then, what we want to know when the knee does come in, we need to look at the joint above and below. So we've just looked at the hip here to see what's possibly weak. We need to also look at the ankle joint, because if that arch there in the foot collapses, then the foot's obviously going to hyperpronate, it's going to roll in, and the knee's going to track in after it. So the knee coming in can be because of what's happening at the ankle. But if in this case here, as we can see, the ankle is actually nice and straight through that malleolus there, from the lateral aspect to the medial aspect, that's nice and straight. The arch there in this image looks normal. So we can't say that the knee is coming in because of the foot in this instance. So hence we draw our attention up to the hips to see what's going on there. And then we would do the gluteus medius strength test for sure. We'd also have a look too at the Thomas test, and especially to see if the IT band is tight. Because we've seen down here that the TFL, which attaches into the anterior fibers of that IT band, if the TFL is tight, then that can cause tightness in the IT band. We would then see that the knee, from the front view of the Thomas test, we would see that the knee is abducted, so it would be out slightly wider than the width of the hips. And here's a test you may not have thought of doing. Many recent studies have shown that during a one-legged squat or a two-legged squat, that people had their knee coming in a lot more who had a loss of ankle dorsiflexion. So testing ankle dorsiflexion is a very good one because it's quite an easy one to improve. By releasing and rolling the gastrocnemius and the soleus, we can get an increase in dorsiflexion. And as the studies show, this decreases the knee tracking in during a squatting pattern. So again, in terms of exercise prescription, we're looking simply at which muscles here are weak, which muscles are tight, and we're providing exercises to release and stretch those muscles that are tight, and exercises to strengthen the muscles that are weak.